Metro Atlanta started basically in late 2000. We began with 1 ambulance and 4 employees. Our goals have always been to be as responsive to the citizens that we serve, and at the same time we take care of our employees, and it all comes together as a great delivery model for EMS in our counties that we service. Today we have over 700 full-time and part-time employees throughout the metropolitan Atlanta area and Savannah. And I don't mind today telling you that it's been a real honor and just a privilege to have worked with all these folks that we have.
Pete Quinones and the Metro Atlanta Ambulance Service team are a key partner to public health in this community. They help us with emergency response, educating families about how to keep their children safe and free from preventable injuries. They bring resources to many of our public health initiatives, and they bring their business expertise for us to inspire other partners to step forward.
Our goals have always been to be as responsive to the citizens that we serve and those that are in need, and not necessarily are the ones that are financially the most set. So the health department does the same thing. They have that same, they basically service the same group of people that we do, the underserved, the most demanding, and we're able to work together to help these folks in different scenarios.
Over the past year, Pete and Metro Ambulance have donated over 2,500 hours of volunteers to our local not-for-profit and other agencies. 2 examples of that are the Cobb Safety Village and Marietta Kiwanis. In addition to those volunteer hours, Pete and his agency have contributed over $250,000 in financial contributions and over $120,000 in in-kind services to local agencies. One example of this is the 5 AED devices that they contributed to the Marietta school system, which they also maintain and provide supplies for annually. And last but certainly not least, since Pete and Metro Ambulance's primary mission is healthcare, they provided over $6.5 million of uncompensated emergency health care in the past year.
Pete Quinones and his company give daily to the residents of Cobb County when it comes to emergency care. And it's in the millions of dollars of uncompensated care. And even when they are providing it and get paid through the insurance plans, they are bringing a higher level of quality than you will see anywhere else. They constantly are looking for ways to increase their quality of staff and the services that they provide. So I believe that one way they make a real difference is by just assuring the quality of emergency response in our community. The second way I think they make a difference is not just stopping there. They go on and on and on wherever is needed and wherever they can bring their resources and their talents. Well, to give you an example, Pete's VP, Devin Seabaugh, has been at the table with us with Safe Kids for 25 years.
Safe Kids Cobb is one of our biggest contributions. We have a lot of folks that are volunteer, that spend time with the program in order to, I guess the biggest piece would be the car seats, where we secure car seats for folks that are unable to have them, and those that do have them and not sure how to install them. So it's a big part of what we do to give back to the community, and we're very excited about it.
The primary ways that Pete and his agency have improved health outcomes is to provide high-quality emergency care and transport across Cobb County and Metro Atlanta. Another way that Pete and Metro have contributed is to have assisted in providing high-quality training to over 2,200 EMTs in our area, including those at the local city and county fire departments. When the state of Georgia mandated CPR training for high school students, Pete and his staff stepped up to the plate and provided training for over 2,200 students and staff at Marietta High School. Metro Ambulance not only provided the instructors, but also created a fund at the Cobb Community Foundation to provide financing for this mandate. This means that 100% of their buildings have readily accessible AEDs and that their employees are well trained in the techniques of CPR.
I always bring up the fact that in all my years that I've been in this industry, I've never received a thank you letter saying, "He did a great job intubating me." He started that IV with just the utmost skill set. It's always been an issue of they showed compassion, they cared, they heard me, they took care of me, and that's what it comes back to, basically where the rubber meets the road, where that compassion, that care is what separates us from, I would like to say, the other parts of the industry.